In this video, I'm going to be bringing you excerpts of an interview that I had with a doctor who is part of the COVID-19 vaccination program. Coming right up after this. What's happening, my beautiful people? Welcome back to the channel. My name is Richard, and on this channel, I try to provide tips, tricks, strategies to enhance your international student experience. I also share my experiences living in the US for a while. So if this is content that you like, consider hitting the subscribe button and clicking on the notification bell so that anytime we drop a new video, you will be notified. Also follow us on Twitter at globe_engage to stay up to date with sneak peek and previews of our upcoming videos. So in my previous video, I shared my experience as I was going to take my COVID vaccine. But when I was there, I had an interview with one of the doctors who is actually in charge of the whole vaccine distribution process within the Richmond area and VCU community. So in this video, I'm bringing you that interview and some of the questions that the doctor answered. I know that most of us have more questions than answers as far as the vaccine is concerned. So hopefully this video answers some of the questions that you may have. So here is my interview with Dr. Allan Dow. Enjoy. Can you please just tell us your name and what you do here?
Sure. So I'm Allan Dow. I'm a physician. Most of the work I do is in the hospital, though I do some community work as well with free clinics before all of this happened. And since we've been vaccinating, I've been the medical director of our vaccination efforts through VCU, both within sort of VCU and VCU Health system, but then also out in our community events that we do as well.
Okay, cool, thanks. And since this whole vaccination process started, what has been your biggest challenge, or what has been some of the challenges or barriers that you faced as far as administering the vaccine is concerned?
Yeah, so until now, the biggest challenge has been that people who want the vaccine have outnumbered the number of vaccines that we've had. So it's been an issue where demand is higher than supply. And so it's not been a problem to fill vaccine events of people that want to get vaccinated, because there are lots and lots of people that want to be vaccinated. The federal government and state government have been helpful because they have tiers to say who's highest priority and so where people go. And just as we've sort of gotten to the end of one tier, they'll open up the next one. So we're in tier 2 now. We went through 1A, 1B, 1C, but we always had plenty of 1Bs to vaccinate before we got to 1Cs and plenty of 1Cs before we got to tier 2. Okay.
So in the United States, there are 3 different vaccines. In Ghana, where I come from, there's only one, right? And so I'm in the United States. I was scheduled to take Johnson & Johnson, and then I got here and they were like, nope. Something happened, we had to switch. What is the main difference to a layman's perspective between these 3 vaccines that we have?
Sure, yeah. So the Pfizer and the Moderna vaccines, they work using messenger RNA, which is a brand new technology, basically. Someone's probably going to win a Nobel Prize based on this work, but it's a brand new way of thinking about vaccines, and they were able to develop it very quickly, test it very quickly, show that it was safe and effective, and get it out into use. I got my first Pfizer vaccine in December, like you got today, and then got my second dose 3 weeks later in January. And we know that those vaccines are very safe and very effective. The Johnson & Johnson vaccine and the AstraZeneca vaccine, they're, I believe, both DNA vaccines, and so they use a little bit of a different way of providing the vaccine. And I'll say there's many vaccines that are being studied. It's over 70, and many of them use different techniques. So we're learning a lot about how vaccines work. It looks like the AstraZeneca vaccine and the J&J vaccine have a very low risk, about 1 in a million, of having a clotting problem that happens after them. It's something similar to what we call TTP, or thrombocytopenia purpura. But the idea is that your clotting system gets more revved up than it should be. And so we've seen in the US with the J&J vaccine, 6 cases out of 7 million doses, which led to the pause this morning. You're supposed to get J&J, and then you end up, we all had to switch and get Pfizer, give Pfizer today, and you got Pfizer today. Same issue that they've seen with the AstraZeneca vaccine. Primarily in Europe is where that conversation has been going on, as far as I know, and pauses in many countries with that. That being said, a 1 in a million risk from a vaccine is still a lot lower than the risk of death from COVID. So it's one of those things, if you can get the safer vaccine, the Moderna and the Pfizer, you probably should get it. But if you don't have that as an option, then AstraZeneca and J&J are still pretty safe. But they're things that we want to kind of understand more in the US, because we have safer alternatives right now with Pfizer and Moderna.
Okay. So, I've been vaccinated, you've been vaccinated, all these people have been vaccinated. What does being vaccinated mean? Does that mean I can walk around without my mask? Which I'm sure some people who will be watching this will be like, oh, it's interesting, a doctor speaking in front of a camera without a mask. But what does the vaccination mean? What does it do for us?
Yeah, so it's all about decreasing risk. And so your vaccination status decreases your risk significantly in terms of catching COVID, in terms of severity of disease if you get it, and probably in terms of transmissibility, which is the idea of passing it from person to person. And so the vaccine helps. The reason why we're still wearing masks, and I just took mine off so I could talk to the camera, is that sort of twofold. One is that it doesn't decrease the risk of transmissibility to zero. And so until we get through this and we get the rates down of transmission in the community, we probably should all still wear masks. It's just a good, safe practice. The second reason, the reason why I wear a mask most places I go is role modeling. And I think it's important to sort of say, look, we're going to try to show people that this is a good, safe practice to maintain. Because as we know, the people that wear masks, and the people that don't wear masks, and the people that wear masks but don't really wear them that well. And so I do think there's an important signal that we're saying, hey, we're still trying to get through this. We shouldn't give up until we get to a place where we are sort of have the numbers of people vaccinated and transmission rates low enough to say, let's now demask and try to get back to normal lives.
Yeah, so thank you so much. One last question before we let you get back to ensuring that other people have their vaccine. What would you tell somebody who is either scared or who is either just hesitant to get the vaccine?
Yeah, so it's a great question. And I'll say people are hesitant for lots of reasons. And so part of it is having a conversation about why someone is hesitant about the vaccine. Some people are worried that it's not a safe vaccine. And I can tell you, even the AstraZeneca and the Johnson & Johnson vaccines are very safe. There are things like birth control pills that women take that are much higher risk of clotting than actually even getting these vaccines. And so there's a lot of things that we do. Taking a plane flight is probably a higher risk of clotting than getting the AstraZeneca or the J&J vaccine. That being said, we want to make sure that our therapies are as safe as possible. There are people that are resistant to getting vaccinated because they don't think they're going to get sick and have never been sick. And the reason to get vaccinated, even if you're a healthy person, is so you don't spread it to other people, because we still know that 40 to 50% of people that get COVID have it asymptomatic, and it may not be that person who's got the asymptomatic infection that's going to get in trouble. It's that person who then spreads it to the older adult, or the person that has health problems that may sort of get them sick. And then there are people that I think are hearing lots of messages, particularly via social media, that are downplaying that, and that's a really challenging problem. We know that the group that has the most hesitancy in the United States are rural white men. And we thought it would be people of color in this country would have the greatest hesitancy, but actually, if you look at race or ethnicity, there's not a lot of variation in terms of hesitancy. It's white men that live in the country that are most resistant to getting vaccinated, and that has to do with the media that they've been looking at, and our former president of this country, and so on and so forth. I don't know about Ghana, but I can say that you have to sort of understand some of those social factors that are driving hesitancy too, and how you try to unpack those for different parts of your community that's around you.
All right, thank you so much. So as I'm taking my vaccine, which I'm excited about, fingers crossed, waiting for May 4th, to get my second dose. What or should anybody else do if they get home and they start feeling any discomfort, or they start feeling unwell and they think it's coming from the vaccine? What should they do?
Yeah, so we think that kind of vaccine response where you feel unwell is actually a good sign, and that it means that you're having more reaction to it or having more antibodies to it. We haven't proven that yet. But it's fine to treat it just like any other illness you would have. So taking things like Tylenol or ibuprofen, drinking a lot of fluids, and resting is a great idea. I always tell people when I'm vaccinating, I say, tomorrow you may feel worse, and it's often worse after the second dose than the first dose. So don't plan to have a busy day, and tell the people in your life, hey, you need to take care of me tomorrow. I'm gonna have a nice day on the couch and watch a show or something like that, and just take it easy, because it is a good sign that you're having that immune response.
Okay, thank you so much for taking time off your busy schedule to talk to us. Hopefully your message gets across to as many people as possible, so that at least gets them to start rethinking about the vaccines, and making conscious efforts to get vaccinated once it becomes available wherever they are. And as always, thank you guys and your team for all that you've done, not just for the vaccine but also throughout this whole pandemic. It's unfortunate that we had to wait for a global pandemic to actually see how important frontline workers and medical staffs are. So thank you guys, and we hope that you continue to have the strength and the energy to serve our community. So thank you so much.
Right. My pleasure.
So I hope the interview was insightful. I hope the interview answered some questions that you may have, and I hope that at least the interview helps you to rethink whether or not you are going to take the vaccine. If you get a chance to take the vaccine, please take it, so that at least that'll be one less person that we all have to worry about contracting COVID. And if you are fully vaccinated, don't forget to always wear your mask, so that at least you can protect other people and also lead by example. Until I see you on the next video, stay safe out there, be each other's keeper. Peace.